side of the cranial cavity. This would be lateral, the ear would be over here. This is anterior, so the eye would be in front here. So we have the orbit, the frontal bone cut away to show the orbit. And the structure that's tagged is this nerve here, which would be the nasociliary. The nasociliary goes through the common tendon, and it's going to run from a lateral direction to a medial direction, and it's going to go between the superior oblique muscle and the medial rectus. You can also see the first structure, one of the first structures you see would be the frontal nerve, which is not shown here. The second one, right underneath the frontal nerve, would be the levator palpebral superioris, right here. And then right underneath the levator palpebral superioris would be the superior rectus. You can also, in the upper left-hand corner or upper medial corner would be the superior oblique muscle. And going into the superior oblique muscle would be this nerve here, which would be the trochlear nerve. So the trochlear nerve you would see going into the superior oblique, whereas the nasociliary, you would see it going in between the superior oblique and the medial rectus, down deep here. Okay, this is the mucosa underneath the lateral part of the tongue. It's been removed. So here's the mouth here. This would be anterior this way. Here's the nose. And coming from a superior and deep part of the mouth would be the lingual nerve that would come down from the infratemporal fossa to go into the tongue. The hypoglossal nerve would be coming from a deeper aspect, and it will come up to innervate to the tongue. This is the medial part of the skull after it's been cut in half. You can see here's the nose here, the eyes. So we open it up, and you can see the tongue here. And coming from the tongue, or on the mandible, there's mental spines. The tip of the mental spines are called genio. So from those mental spines, you would have the genioglossus going up to the tongue, and then going more inferior, just below the genioglossus would be the geniohyoid. So you have the genioglossus meshing in with the intrinsic muscles of the tongue, and the geniohyoid coming from the inferior mental spines going to the hyoid bone. And right in, just inferior to the geniohyoid would be the mylohyoid, right down here. So you'd have genioglossus, geniohyoid, mylohyoid, and then anterior belly digastric would be under that. This will now be a posterior view of the head, of the neck. Here's the tongue from the back side. Here's the epiglottis. So this is the pharynx here. Coming down here would be this structure here would be the internal carotid artery, just bifurcated from the common carotid artery. And running posterior to those two would be the vagus nerve here. And one of the branches that comes off the vagus superiorly would be the superior laryngeal nerve. So off the vagus, superiorly, you would have the superior laryngeal nerve, which branches into an external branch which descends actually lower, and an internal branch which is more superior. And the internal branch is going to pierce the thyrohyoid membrane. So superior laryngeal nerve coming from the vagus, giving off, branching into the internal, which would be the one that's marked in blue, and the external, which descends inferiorly. Skull that's been split in half. So this is the medial surface, or looking at the lateral aspect of the nasal cavity. Here's the tongue, epiglottis. So this area in here would be the oral cavity, and the nasal cavity, and the nasopharynx. So in the nasopharynx, here you can see the auditory tube, and actually displaced rather deeply here would be this structure here, which is the tensor palatini. Totally just a little bit down. The tensor palatini here. It's going to be directly posterior to the medial pterygoid plate. And don't get it confused with the levator veli palatini, which is going to be actually a little more medial and posterior, and it would descend to insert into part of the uvula or the soft palate. So the tensor veli palatini is going to be more lateral, and you can see it. It's going to be more tendinous too. And the levator veli palatini would be mostly muscular fibers. So this again was tensor veli palatini, be able to distinguish between the two.
That's it? Cut.
Again, we have the head here, and we've split it in half. Here would be the right half of the tongue, the left half. So this in here would be the oral cavity. The nasal septum's here. Now we're going to be looking into the orbit from more of a medial view. The most superficial structure in the orbit would be the frontal nerve. So the first nerve you would see, it runs the entire distance from the posterior part of the orbit to the inferior part of the orbit to become the supraorbital nerve. And running in the supramedial aspect of the orbit would be the superior oblique. And again, the nerve going to the superior oblique, you can see, would be the trochlear nerve. And this structure, actually, part of the ethmoidal cells have been removed here, allowing you to see the medial rectus here. So you have the superior oblique and the medial rectus in the orbit. The tongue, and this was the lateral nasal wall. The superior, middle, and inferior concha have been removed, and when you remove them, you actually look into the maxillary sinus. Running in the top of the maxillary sinus would be the infraorbital nerve. So any structure that's tagged in the maxillary sinus from the superior aspect would be the infraorbital nerve. You can also see the infraorbital nerve if you come in. Still here? Yep. If you come in through the maxillary sinus here, which you probably won't be able to see from this. So this in here would be the infraorbital nerve from the front. If you think about it, in here, which has been split apart, and to show the posterior aspect of the pharynx, here we see the tongue, epiglottis, and in here would be, this would be the posterior aspect of the pharynx. And so from the epiglottis going to the arytenoid cartilages, you would have the aryepiglottic fold, which is really the superior aspect of the quadrilateral membrane. So this whole part right here would be the quadrilateral membrane. Inferior surface forming the false vocal fold, false vocal cords. So posterior, if that's closed, this structure here, this part right here would be the posterior lamina of the cricoid cartilage. So the cricoid cartilage is here, and going inside, this would be the inside view. On the outside of the cricoid cartilage would be the posterior cricoarytenoid muscle. Posterior cricoarytenoid muscle, taking its origin from the cricoid cartilage and inserting into the muscular process of the arytenoid cartilage. This whole area in here would therefore be the piriform recess. This would be the lamina of the thyroid cartilage, inferior horn, superior horn, piriform recess, aryepiglottic fold, quadrangular membrane, and then this again would be the posterior cricoarytenoid. Okay, here's the head again. We flipped it forward to show the prevertebral muscles here. This would be longus colli, and just laterally here would be anterior scalene anterior muscle here. This artery here would be the subclavian. Coming off the subclavian would be the thyrocervical trunk. The structure that was tagged was the vertebral artery that comes off the subclavian and ascends between the anterior scalene and the longus colli muscle. Mouth and chin. The parotid gland would be just anterior to the ear. Coming from the anterior surface of the parotid gland would be the parotid duct. That's very superficial, and it's going to pierce the buccinator muscle. So we're looking at the posterior aspect of the skull, reflecting it. So here's the tongue, the base of the tongue, and this is the epiglottis here. So again, this would be the piriform recess here. Posterior aspect of the larynx with the posterior cricoarytenoid. This would be the superior pharyngeal constrictor. The middle one takes part of its origin from the greater and lesser horns of the hyoid bone. So the middle one would start the hyoid and move posterior laterally and come around to insert into the median pharyngeal raphe. Lateral to that, here, this is the common carotid artery, bifurcating right here into the external and internal. And this is the internal jugular vein, and the structure that was tagged was the vagus nerve, which in this view would be posterior and in between the common carotid and the internal jugular. The mandibular region from below. This is the anterior belly of the digastric. Hyoid bone would be right here. This would be the thyroid cartilage, or the Adam's apple. The cartilage is here. Coming from the cricoid, going to the thyroid cartilage would be the cricothyroid muscle, right here. Coming from the thyroid cartilage and going to the hyoid bone would be the thyrohyoid muscle, which has been tagged. So the thyrohyoid muscle is this muscle in here, thyrohyoid muscle, which is going to be reflected laterally. This would be the throat. These are the strap muscles. This here would be the common carotid artery and the trachea here. So down here you would have the thyrocervical trunk. It's going to give off the inferior thyroid artery right here, inferior thyroid artery, and that's going to run very close to the recurrent laryngeal nerve. So this was the vagus. It's going to loop around the aorta this way. And then the branch that comes off is the recurrent laryngeal nerve. This would be the inferior thyroid artery. And here, this would be the subclavian, the left subclavian, which is going to give off the vertebral artery. And again, the thyrocervical trunk will give off the thyrocervical trunk will be the suprascapular artery and the transverse cervical artery superiorly. And these actually pull down the phrenic nerve that runs on the anterior scalene muscle. Under the mandible in the submandibular region, here's the mandible. This would be the anterior belly of the digastric. Under that would be the mylohyoid muscle. That's been reflected back. And in the interval between the mylohyoid muscle and the hyaloglossus muscle, you'll have 4 structures that can typically be tagged. One would be this structure here, which comes lateral from the internal and external carotids and lateral to the hyaloglossus. This will be 12, the hypoglossal nerve, which will be the most inferior structure in the interval. Also in the interval will be the lingual nerve. The lingual nerve is going to come from the infratemporal fossa. It's going to run in between the hyaloglossus and the mylohyoid. This would be the submandibular ganglion. And the lingual nerve is going to pass lateral to this structure right here, which would be the submandibular duct. So the submandibular duct will extend from the submandibular gland, go medial or deep to the lingual nerve to empty into the base of the mouth. Also, you can see from this angle, well, what was tagged was the hyaloglossus. So this was the hyoid bone, and you have the hyaloglossus, this entire muscle, hyaloglossus. And just anterior, almost to the same plane, would be the geniohyoid. Here, geniohyoid. View again of the head. Here's the nose, the mouth. We've opened it up. This would be the hard palate, and this would be the soft palate. Inferior would be the oral cavity. In the lateral nasal wall, here, this would be the lateral nasal wall with the inferior and middle concha and superior. Just posterior to the middle concha would be this structure here. This would be the pterygopalatine ganglion. The greater palatine nerve coming from there, which would be a larger nerve compared to the lesser palatine nerve, which would be posterior. Again, you can see this would be the medial pterygoid plate. Deep to the medial pterygoid plate would be the tensor veli palatini. Again, notice it's deep and lateral to the levator veli palatini, and it's also more tendinous. Just posterior and medial would be the levator veli palatini, which rises from the eustachian tube and is going to insert into the soft palate. So the levator veli palatini, tensor veli palatini, more lateral. Okay, here's again the inside of the cranial cavity, reflected laterally. This would be the common carotid, and on the right side, here's the right vagus nerve. On the right side, it's going to loop around. It'll give off the right recurrent laryngeal nerve, which will loop around this right subclavian. And right here, this nerve would be the right recurrent laryngeal nerve coming off the vagus as it courses just anterior to the subclavian. And also from this view, you can also see the inferior thyroid artery here. The head again, the inside of the cranial cavity. It's been reflected laterally. Here's the tongue, oral cavity, hard palate, soft palate. This would be the nasopharynx, and this here would be the oral pharynx. So this forming the lateral wall right here would be the superior pharyngeal constrictor. And if we reflect that medially, there's really only one muscle that you can see that's going to have this course. It comes from the styloid process, located superiorly and deep, and it's going to go inferior and medially, and it's going to lead right into the pharynx, between the superior and middle pharyngeal constrictors. So this muscle here that's been tagged would be the stylopharyngeus muscle. The styloglossus muscle would be deep to the stylopharyngeus muscle. And really, the best way to tag the styloglossus muscle, here again, here's the mandible. Here, this would be his ear. This would be the posterior belly of the digastric, stylohyoid, and underneath the stylohyoid would be this muscle right here, would be the styloglossus. It comes from the styloid process, which is right here. This is the styloid process. So you have the styloglossus muscle that fades into the tongue. And again, from the posterior view, hard palate, soft palate, lateral wall of the pharynx, this would be the stylopharyngeus muscle. And this is really the only longitudinal muscle that you would tag outside the pharynx posteriorly, and on it you'll see the glossopharyngeal nerve, which is not on this one. So stylopharyngeus muscle. Okay, this again is this inside of the skull. It's been opened up. Here would be the epiglottis, and this would be the lateral wall of the pharynx. This muscle here would be the superior pharyngeal constrictor, and down here would be the inferior pharyngeal constrictor. Again, one of the only muscles you can tag from the back that's going to be outside the pharynx from this aspect would be the stylopharyngeus. And if you see a nerve on top of the stylopharyngeus traveling with it, it will be the glossopharyngeal nerve, which will pass between the superior and middle pharyngeal constrictors. Mouth, his chin. This would be the trachea. What was tagged was the inferior strap muscles, infrahyoid strap muscles. This one here, lateral, would be the superior belly of the omohyoid, coming from the hyoid bone. This one would be the sternohyoid muscle, and then inferior to that, thyrohyoid. The sternothyroid has been removed. It would come up here, and it would be located just inferior to the sternohyoid. Zygomatic arch has been removed. Here's the anterior part. There's his nose, his mouth. In the infratemporal fossa, you would have the lingual nerve right here, which would be traveling just lateral to the medial pterygoid. This would be the medial pterygoid. And the only joint that's going to join the lingual nerve would be the chorda tympani right here. This would be the chorda tympani. And you can also tag the chorda tympani from inside. So again, here's the hard palate, soft palate. This would be the medial pterygoid plate and the hamulus. This muscle would be the medial pterygoid muscle. Alright? So coming through the superior pharyngeal constrictor, you can see this would lead into the infratemporal fossa. This nerve here would be the lingual nerve and the chorda tympani.
Tilt it just a little bit. This way. Turn it. Rotate.
The chorda tympani would be joining the lingual nerve from the inside. This is the medial side of the head. Here's anterior of the nose, the hard palate. This would be the oral cavity. And here's the tongue. This is the soft palate. And this is the uvula. And coming basically off the uvula, or the soft palate, you'll have the palatopharyngeus muscle. You'll be able to see going from the palate and blending in to the pharynx. And here, this area in here would be the oral pharynx. So the palatopharyngeus muscle will come from the soft palate and blend in with the stylopharyngeus would be deeper, and then it would join in with the palatopharyngeus here. So again, the palatopharyngeus muscle. Inside the skull from the superior view, here's his nose, his mouth, his chin. So we're opening it up. This would be the oral cavity here, hard palate, soft palate, and the tongue. Coming from the soft palate, going to the tongue would be the palatoglossal arch, and if you remove the mucosa, underneath that would be the palatoglossal muscle. And again, posterior, bounding the posterior palatine fossa would be the palatopharyngeus muscle here. This is a view. Here's the mandible again, his mouth, nose. So this is the infratemporal fossa. And traversing the infratemporal fossa would be the maxillary artery. Really, the only things that are going to would be tagged off the maxillary artery would be the maxillary artery, the inferior alveolar artery, which would accompany the inferior alveolar nerve, and possibly the middle meningeal artery. So maxillary artery, inferior alveolar artery, and middle meningeal artery. Now if we also look here in the inside of the cranial cavity, here's the middle cranial fossa, anterior cranial fossa, and posterior cranial fossa. This would be the internal acoustic meatus. And last year, this structure here was tagged in the posterior cranial fossa. This nerve here would be the abducens nerve. It's going to go pierce the dura and travel in the middle cranial fossa, which will be located just lateral and inferior to the internal carotid artery. Here's his nose, his mouth. This would be his cheek. And this structure here was tagged. This is the facial nerve. Comes from the stylomastoid foramen, runs through the parotid gland, and it's going to split into its five branches. Just really have to know that it's the facial nerve right here. And if we look at this side, this is the orbit that the lateral orbital wall has been removed, taking its origin from the inferior aspect of the orbit and wrapping around laterally would be the inferior oblique. Right here, that's what was tagged. Inferior orbital oblique. And a nerve running right above the inferior oblique would be the inferior division of the ocular motor nerve. So the inferior division of ocular motor nerve, you can tell that's what it is because it innervates the inferior oblique, and it would also innervate the inferior rectus, which would be right here. So the only nerve that really runs in the lower part of the orbit at this point would be the inferior division of the ocular motor nerve. The infraorbital nerve would actually be right underneath here, right underneath the floor of the orbit.